international assignment, he's not he's not able to make it to join us. You can see that he has held a meeting. While he was in that meeting, already he is behind schedule for the next assignment. So he has sent his apologies, but he is with us because he is a highly committed officer of Nigeria, and he is somebody who is anxious to take us to the next level of healthcare in this country. He sent his gratitude to all of you who has participated in bringing us together for this activity. So you are all welcome. The Minister has some few messages in relationship to this program, but I think since I'm representing you at events go on, I will participate effectively on behalf of the Honorable Minister. Thank you very much. We can start up from there. I think somebody will introduce the topic, or do I still go on? Somebody is scheduled to introduce this topic. Who is scheduled to introduce the topic?
Okay, thank you, Honorable Minister. So this morning we're talking about prematurity and celebrating by media briefing the World Prematurity Day, which is actually on November the 17th, which is a Sunday. But we're starting off on a working day with something that involves a lot of the actors around prematurity. A premature baby is one that is born before the baby is 37 completed weeks. And so there are several ways of understanding that. For the layman, is somebody who is born before the child is 9 months. But we know there are different types of premature babies. Some are born very early, before they are 28 weeks. Some are born a little later, between 32 and 37 weeks. But no matter when they are born, as long as they are born before 37 weeks, they are premature. And these babies, we can hear one who is letting us know he was premature in the background. They have special needs, but they also form the burden. They form a huge burden for children who die in the first month of life across the world. And so I would ask the Honorable Minister to just give us a little bit about the burden of prematurity and some of its problems.
Thank you, Nana. I think, like you said, the premature child is the one that is born before 37 weeks of gestation, full gestation. That's to mean that a child who is born before the 259 days of life inside the womb. That means this child will require special needs and best available support for survival. Globally, approximately about 15 million of children are born premature. That means 1 in 10 child is born premature. And in this country, it accounts to about 10% of neonatal death, translated to about just about 84,000 deaths in Nigeria from neonatal death. Now, we made a lot of efforts, we know, in the area of maternal and child health, because the present trend in the infant and maternal mortality is gradually declining. This will be revealed to all of you by the time the 2013 National Demographic Health Survey is released. But I think it's important to mention that preterm delivery remains the leading cause of maternal neonatal mortality in this country. And of course, from our NDHS 2008, it accounts to 62% as a leading cause of infant mortality. And like I said, in Nigeria, it also accounts for over 10% of neonatal death and 50% of long-term neurological deficit in children. I know that considering this burden, you will judge from this fact that it's an enormous task on human resource, on finance, and of course on service delivery in this country. To put it precisely, most developing countries, including Nigeria, cannot cope with this enormous burden to cope with this number of children that are born. But like I said, a lot of efforts are being made at different levels of care. Now, the costs associated with managing of these children are also so high that both, especially in rural areas, the resultant effect or outcome is that of course, death. Medical costs on the premature also are much greater than they are than in healthy children, and of course, than in also full-term babies. And the cost associated with prematurity is more than 10 times higher than the average newborn, especially in a country which is developing like ours. We made a lot of effort, but I think this will constitute another question. But of course, if we look at it, the level of facilities, if we continue to have a higher level of premature children born premature, I look at a situation that the number of facilities in terms of within the institution may not cope. So the best way to reduce that burden is for us to prevent prematurity to prevent the woman from delivering the premature baby itself. So this is much I can say about the burden of the problem in Nigeria. Thank you very much.
Okay. Thank you very much. Thank you, Honorable Minister. He's gone through the approximate burden of disease across the world. And we know that prematurity, even though it hasn't been very well recognized in the last few years, it's obvious now that it is a major cause of newborn deaths. It's the largest cause. It's the most important cause of deaths in newborns. And so it's something that we really should be paying attention to. And we also should be paying attention to it because in addition to the numbers, it's also, the children also suffer quite a bit of disability if they're not looked after. And of course, they also have their immediate problems, which will even prevent them from surviving in the first place. And one of the main problems they have is being able to keep their body temperatures. They are born very early, so they haven't acquired the mechanisms, both fat and all the other mechanisms that allow them to keep warm outside of their mother's womb. And therefore, that's a major problem. And we'll have one of our partners talk about what is being done to help babies keep warm in simple ways. They also have problems with infection. They have not also matured enough to be able to provide themselves adequate protection from all the infections outside of the womb. They have difficulty with feeding. They have difficulty with breathing. Their lungs are not mature enough. And they also have some delay because they also just haven't, all their body systems haven't matured enough. So they have delays in acquiring all the milestones that we're familiar with. And in spite of the fact that there are several simple, not necessarily low cost, but simple technologies that can keep children who are born too soon and born early alive and well, there's been quite a bit of focus on the expensive tertiary intensive care. And this doesn't necessarily change the outcomes for the bulk of the preterm babies. Across the world, you have preterm babies are born. If you look at the numbers that are highest in the world, most of them are from Africa. There are only very few countries that have rates outside higher than 15%. So, but most of them are from Africa, and these are low-income countries. So the focus really should be on what you can do in simple ways to keep these children alive and well. And the Honourable Minister has talked about the costs, and I think that's a very important thing for us to note. But the reason we're also, we know that preterm, the prematurity is important, is also the link with other causes of child death, especially pneumonia. On the 12th of November, which was a few days ago, we celebrated the World Pneumonia Day. So pneumonia is also an important cause of death in children who are premature. So this is a really important link, and it's good that they're both happening in the same month, so we can actually focus attention on things that kill children in the first month of life and in their first 5 years of life. So if we put the two together, we can see that the World Pneumonia Day and the World Prematurity Day are very closely linked. The things that save the lives of newborns and save the lives of mothers and save the lives of children under 5, all the interventions are very closely linked, and they can all be implemented across the continuum of care. So this celebration that we're doing today is really the beginning, and like I said earlier on, it's actually on the 17th of December. So Nigeria is joining the rest of the world to mark the 3rd World Prematurity Day. The theme is "Every Breath Counts," and we have a slogan that is "Born Too Soon, Hold Them Close." This day was first marked as the International Prematurity Awareness Day in 2009 across the world, and it was officially launched and celebrated in 2011 as the World Prematurity Day. This year, the Federal Ministry of Health and all its partners is working together to celebrate this day so that we can show the world that we've got a wide group of partners that are interested in making the premature baby count for Nigeria. Premature birth touches everyone, and therefore the emotional cost for families can be challenging and life-changing. Maybe we would start by asking one of the mothers.
Just let me. I think it's important I try to re-emphasize why prematurity is very important to us as a government. If you look at the background of my statement, prematurity accounts for a greater proportion of infant mortality. And therefore, if we are able to prevent prematurity and reduce neonatal death, that means we'll be able to meet the MDG goals 4. And that is the central point for us as a ministry. The director from Primary Healthcare has given a good background of what could lead to this prematurity. And I think to build more on the background for the understanding of our audiences, we need to give chance for others also to comment. But it's important to mention that what we call premature rupture of membrane is a fundamental and very fundamental, a big contributor of premature birth. What I meant by premature rupture of membrane for our audience is when a woman starts draining water, well, she's not supposed to drain. Of course, that process may end up